Hello and welcome to HIPAA Awareness 101 presented by Certify Myself, education with certification anytime, anywhere. It has been determined by either you or your employer of your need for HIPAA awareness training. After this HIPAA Awareness 101 module, you should be able to understand the purpose and provisions of the Health Insurance Portability and Accountability Act. You'll be able to define the terms privacy and PHI. You'll understand what is expected to protect protected healthcare information. You'll understand the depth and scope of privacy violations and penalties. You'll learn practical and useful protection strategies. And finally, we'll wrap things up with a general overview of what we like to call HIPAA in a nutshell. So let's get started. HIPAA is a federal law. HIPAA stands for the Health Insurance Portability and Accountability Act. It is a law that must be followed by all healthcare personnel at every level, both professional and non-professional. Companies that provide vendor or ancillary services to healthcare providers, they must also follow HIPAA guidelines. If these companies contract with another company, that subcontractor also must follow HIPAA guidelines. Anyone along or in this chain can be fined for a breach of protected health information, even if the breach is inadvertent. The United States Department of Health and Human Services and the Office of Civil Rights take the privacy of health information dead serious. The purpose of HIPAA is to protect the privacy of all patients and residents of the United States who receive any kind of healthcare service. It does so by setting basic national privacy standards and fair information practices. For the remainder of this HIPAA awareness training, the Health Insurance Portability and Accountability Act will be referred to as simply HIPAA. So what is HIPAA? HIPAA was passed by Congress in 1996 with four basic provisions. Number one, to provide workers and their families the ability to continue their health insurance coverage when they lose or change jobs. To reduce healthcare abuse and fraud. It's also used for mandatory standards for electronic billing and healthcare information processes. And then the fourth provision is set in stone to require confidential handling and protection of protected health information. This privacy component of HIPAA is the central focus of this HIPAA awareness training. With these four provisions in mind, let us ask who is mandated to follow HIPAA guidelines. Healthcare providers, such as doctors, dentists, clinics, therapy centers, hospitals, nursing homes, psychologists, etc. Then we have health care plans, such as health insurance companies, HMOs, company health plans, and government plans that pay for health care. And then there are healthcare clearinghouses. These are entities that process non-standard health information that they receive from another covered entity. And then you have any business associate of a covered entity. They must follow HIPAA guidelines, and this must be outlined in their business associate agreements. Most healthcare organizations, hospitals, skilled nursing facilities, and home health agencies have contractual agreements with other vendors which may give their vendors access to PHI. HIPAA allows for sharing of PHI under certain circumstances, and it is necessary to determine who a business associate is. Here are some characteristics of a business associate. They perform services that involve the use or disclosure of PHI. They also perform services including claims processing, data analysis, utilization review, quality monitoring, accounting, legal services, medical waste disposal, management, and/or billing not performed by their own staff. They also perform destruction, shredding, e-scanning, and storing of PHI. Your office or facility should have on file all business associate agreements that are currently in place. If you're ever in the situation and you're not sure you should disclose PHI to a work associate or business associate, then stop and ask your supervisor, upper management, or the business office manager. Think of it like this. If it is possible for someone you work for or with to have reasonable access or use of protected health information, they're most likely a business associate and must follow HIPAA privacy guidelines. Certify myself. Education with certification. Anytime, anywhere.